Okay, welcome everybody, and thank you very much for coming this evening. I know it's a bit late and it's been a long day, so I hope that you'll find this session interesting. I know we're all very excited about the attention that we're now bringing to the supply chain workforce. I'm just going to give an overview of the health workforce and supply chain management with a particular focus on low and middle income countries. Every year, over $10 billion are spent by development partners procuring health commodities for low and middle income countries. And this has resulted in a huge increase in the quantity, value, and complexity of medicines and commodities flowing through public health supply chains. Still, over 1.7 billion people, that's nearly 1/3 of the world's population, lack access to essential medicines. The first chart here shows you, which I'm sure many of you have seen throughout this Congress, the increasing number of people in the world on ART, from under 1 million in 2002 to over 6 million in 2010, a large majority of whom are in sub-Saharan Africa. And this is just one example of the increasing need for a well-functioning supply chain. The second chart, which isn't impossible to read, but the idea is to show you how complex supply chains are, looking at international and national level, as well as public and private sectors. Everyone in this room, I'm sure, appreciates that supply chains rely on people, on human beings, and all people who are responsible in some way or another for supply chain management are part of the supply chain workforce. And as Pop already mentioned, these are supply chain managers, they're logisticians, they're also doctors and nurses who have some function related to supply chains. And they can be clerks or truck drivers who are responsible for ordering supplies or transporting supplies from one place to another. So the presence of a well-functioning supply chain workforce cannot be left to chance. Like any other workforce, it requires dedicated planning, financing, education, and training, recognition, and support. And these charts show an example of how a 24-fold increase in the value of new vaccines introduced in a country resulted in a 5-fold increase in the workload for supply chain management. And it illustrates that when decisions are made to increase the availability of medicines and supplies, these must be combined with decisions on how to strengthen the supply chain management workforce by either adding more workers to the force or reorganizing the workforce and making it more efficient. This chart shows the functions of the supply chain management workforce, which are carried out every day by supply chain workers, from product selection to quantification and procurement to inventory management and serving customers, all of which are subject to quality monitoring and all of which must be supported by functioning information systems, monitoring, organization, staffing, budgeting, supervision, and evaluation. In the area of human resources for health, we have two important frameworks that help us to analyze and take action on the health workforce. And these are the HRH Action Framework, which was developed by GWA with inputs from WHO, USAID, and other partners, as well as the Working Lifespan Approach that was proposed by the World Health Report 2006. If we look at the HRH Action Framework, I'll focus on that one. These frameworks really provide a holistic approach to workforce development and management that includes a cycle of information, collection and analysis, planning, implementation, monitoring, and evaluation. Very much a programmatic cycle, but it focuses on some very critical aspects of the workforce which tend to be overlooked, such as policy on the workforce, financing, education, and partnerships, and particularly partnerships between different sectors, between health, education, labor, and finance, and also between institutions such as educational institutions and health service delivery institutions. And of course, leadership is an important area as well, where one needs a good vision about the needs and about the results that are required from the workforce. So if we look at the supply chain management workforce through the lens of these frameworks, in the area of information and governance, we see that information is quite limited in terms of specifically related to supply chain management. We know from the World Health Report 2006 that there's a shortage of 4.3 million workers, and those workers include something called support workers. But HRH information systems don't really collect data specifically on the supply chain workforce, or maybe some do at national level, but not regularly. And supply chain workers are rarely considered a professional cadre by ministries of health. And one example, because underqualified or overqualified workers will tend to fill in, one example is in Mozambique, where among the 46 pharmacists in the country, 10 of them were working in the central medical store when a survey was conducted there, doing supply chain functions that aren't not necessarily functions for pharmacists, leaving 36 pharmacists to cover the immense need of the rest of the country. So here you can see the importance of information and governance and gathering information in order to plan the workforce in a more cost-effective and rational way. Workforce planning and financing is quite limited, of course, in focus in general, and particularly in the supply chain workforce. And few national human resource for health strategies and plans actually include plans for the supply chain workforce. And at the same time, human resources are seldom addressed in national supply chain plans. And to overcome this gap, many countries actually outsource key functions, such as transportation, to private organizations. If we look at workforce development and quality assurance, a situation analysis that was conducted by members of the People That Deliver initiative found that many countries need more appropriate pre-service education and in-service training. And this is education that's related to dedicated supply chain professionals, producing dedicated supply chain professionals, but also in incorporating key or core competencies related to the supply chain into the education of other clinical and non-clinical workers. And again, there's the need for recognition and qualifications and certification of these workers. They've found that a lot of staff are trained in supply chain management functions, but because they're not recognized as having these competencies, often they're shifted into other types of work, and then there's a need to retrain those that are doing supply chain management. And of course, the need to train the right people. One of the ministers of health in the situation analysis said, when you use a nurse or a physician as a logistician, you lose the nurse or physician and you don't get a good logistician. So you can see the importance of recognizing these functions and improving the professionalization of the workforce. Again, workforce management, recognition, and performance. The challenges here are very similar to the general health workforce. We find, again, recognition as a profession is an issue. There aren't necessarily professional associations where logisticians and supply chain managers can meet and discuss their needs and potential policy changes. Job descriptions are often not clearly specified. There's a high turnover for a number of reasons, and of course limited continuing professional development and career pathways. So what are governments doing, or what's being done? Of course, today we're going to talk about the global initiative, the People That Deliver initiative, but also about what governments are doing themselves at national level to improve the situation. And for example, some are actually including plans for the supply chain management workforce into their national HRH plans. Some are creating special supply chain management units within their ministries of health that also look at the supply chain workforce. Others are outsourcing certain functions or even the whole supply chain management function. For example, in Ethiopia, they've created a semi-autonomous agency, which is called the Pharmaceutical Fund and Supply Agency, which is responsible for all of supply chain management at this point. Others are training and deploying supply chain managers at district level. In Zambia, there was a pilot study placed supply chain planners at district level in district warehouses and was able to increase the availability of pediatric malaria drugs to 88%, compared to 51% in the control sites. So in conclusion, firstly, health supply chains are people supply chains, and they depend on competent, recognized, and empowered individuals. And secondly, we're proposing a need for a paradigm shift from a lack of professional status and performance in supply chain management to a situation where health supply chains and the supply chain workforce are planned, financed, developed, recognized, and supported in a way that moves us closer to that sustainable access, universal access to medicines and commodities by all people everywhere. Thank you.